the HIV Trust Fund. Thank you. So just like we said before, we'll be updating or continuing the recognition of esteemed guests as they arrive. We'll be out of your hair in a couple of minutes. Right, so this occasion wouldn't be possible without a few heavyweights, a couple of whom I'm seeing here in the hall. I'd like us to recognize the presence of Aliko Dangote. We can give him a round of applause, please. As well as, is it Dr. Herbert Wigwe, who's from Axis Bank? You're welcome, sir. If we could give him a round of applause. I also have people that I work with. So the National Agency for the Control of AIDS, I'd like to recognize the chairman of the board, Senator Oladurin. You're welcome, sir. And obviously my own directors here present, I'd like to welcome all of you. In terms of the seating arrangement, if it's possible, can I ask those of you who are seated at the back to just move forward a bit? Just move a couple of seats forward, please. Thank you. Thank you, band. I'd just like to acknowledge the presence of a few other people and correct some of the pronunciation mistakes that were made. I've got Senator Odujinre, MFR, who's the chairman of the board of NACA. I've got here present.
May we all rise? May we all rise as we welcome the President, Commander-in-Chief of the Armed Forces, Federal Republic of Nigeria, President Muhammadu Buhari.
Whilst we're standing, can we have the national anthem, please? Thank you very much. You may take your seat. So once again, we'd like to welcome all of you to this launch of the HIV Trust Fund of Nigeria. At this point, I'd like to invite the Director General of the National Agency for the Control of AIDS, Dr. Gambo Aliyu, to give us a welcome address. Dr. Aliyu, sir.
Thank you. His Excellency, President of the Federal Republic of Nigeria, Muhammadu Buhari, members of the National Assembly present, the Secretary to the Government of the Federation, the Chief of Staff to the President, Honorable Minister of Health, Honorable Minister of FCT, and Honorable Minister of Information, members of the Diplomatic Corps, Chairman of NACA Board and board members of NACA present, captains of industries, heads of parastatals and permanent secretaries present, gentlemen and ladies of the press, distinguished ladies and gentlemen. I welcome you all to this epoch launch of the HIV Trust Fund of Nigeria. Mr. President, sir, permit me to first appreciate your commitment and support for the HIV response in the country. As a direct result of your intervention, now NACA procures HIV commodities at manufacturer's rate, as a result of which more Nigerians living with HIV have been placed on treatment from domestic resources. Your Excellency, you may recall that 3 years ago, you personally declared the results of a landmark survey which showed that about 2 million Nigerians were living with HIV. That survey also revealed the most likely geographical locations to find them. At that time, we had only identified and placed on treatment 800,000 Nigerians living with HIV after 14 years of active searching. It is therefore heartwarming to note that within the last 3 years, we've identified and placed on treatment additional 900,000 people living with HIV in Nigeria, bringing the total number of HIV-infected Nigerians on treatment to 1.7 million. This unprecedented feat puts Nigeria on a fast-track lane to control HIV spread by the year 2023, 7 years earlier than the global target. However, despite this achievement, our national coverage of prevention of mother-to-child transmission is less than 50%, leading to about 22,000 cases of new mother-to-child transmission of HIV every year in the country. Furthermore, providing lifelong treatment to all people living with HIV, even after successfully stopping new HIV transmission, would require a domestically sustainable financing mechanism. Mr. President, sir, securing a financing mechanism to guarantee a generation of HIV-free babies is the basis of today's launch. With your kind permission, Your Excellency, I seize this opportunity to appreciate my predecessors, especially the immediate past Director General of NACA, Dr. Sani Aliyu, the UN system, PAFA, and the Global Fund for this initiative. I also commend the passion of today's chief launcher, the chairman of the board of HIV Trust Fund of Nigeria, and the organized private sector. I once again welcome you all to this important event. Thank you.
Thank you very much. Let's put our hands together for the Director General of the National Agency for the Control of AIDS and NACA, Dr. Gambo Aliyu, for setting the ball rolling on this auspicious occasion. We'll take a couple of goodwill messages online. We have the Executive Director of UNAIDS, Miss Winnie Biagima. She will give an address online. She's joining in from Geneva, Switzerland. Thank you.
Secretary of the Government of the Federation, Excellency Minister of Health, years ago. Nigeria is also the country with the highest number of premature AIDS deaths among children, 12,000 deaths 2 years ago. That is why it is the right time that the HIV Trust Fund is launched and that it rightly focuses on supporting financing to eliminate mother-to-child transmission of HIV and pediatric HIV. COVID has tested us all. It's wonderful that the Coalition Against COVID funds has so far raised over 20 billion naira. The COVID crisis threatens to push our progress back on tackling AIDS. But all of us here are determined, I know, to fulfill our pledge to end AIDS in Nigeria by 2030. And all of us know that we can only do so through a whole of society approach, which involves action by the government, by business, by civil society, and us, UN agencies, and other international partners. Which means that every Nigerian should not be left behind in the response. I'd like to add that pandemics thrive in and expand on the fault lines of inequalities. The data is unequivocal. To end AIDS, we need to end the inequalities which drive it. The health of all of us depends on realizing the rights of every one of us, removing all economic and social barriers for accessing HIV services and other health services. Your Excellency, you are right to insist on an ambitious approach to meet the ambitious targets set out in the global strategy and the political declaration. Business leaders are right to recognize that ending AIDS is both a moral and an economic imperative. In closing, allow me to express our deep appreciation of PEPFAR and the Global Fund for their long-standing support to Nigeria's AIDS response. We will be counting on you to continue standing in unwavering solidarity with Nigeria until the job of ending AIDS by 2030 is done. And we hope it will be ended sooner than 2030. I'd also like to assure you that the joint United Nations program on HIV/AIDS, UNAIDS, is here by your side as you work to realize our shared goal to end AIDS in Nigeria by 2030, before 2030. Thank you, Your Excellencies.
Thank you very much, Ms. Winnie Byanyima, Executive Director. Executive Director at We apologize for that. Hello. My sincerest apologies for that technical issue. That was Ms. Winnie Byanyima, the Executive Director at UNAIDS, joining virtually from Geneva, Switzerland. We have another goodwill message from Mr. Peter Sands, is on standby. He is the Executive Director at Global Fund.
Your Excellency, President Muhammadu Buhari, Honorable Minister of Health, other honorable ministers, the Secretary to the Government of the Federation, Dr. Aliyu Director General of NACA, Dr. Wigwe, Chairman of the HIV Trust Fund of Nigeria, my great friend and partner, Ms. Winnie Ileima, Executive Director of UNAIDS, ambassadors, distinguished guests, leaders of the private sector, distinguished members of the press. It is a delight and privilege to be with you today to mark this important milestone in the fight against HIV/AIDS in Nigeria. The Global Fund has partnered with Nigeria since the creation of the Global Fund 20 years ago and has disbursed over $1 billion in the fight against HIV in Nigeria. In the current 3-year cycle, the Global Fund will provide $328 million to support the fight against HIV in Nigeria out of a total allocation of $1.17 billion for HIV, TB, and malaria, and to respond to the COVID-19 pandemic. This is the largest investment by the Global Fund in any country at any point in the history of the Global Fund, and reflects the huge importance of our partnership with Nigeria, a partnership that is getting stronger and stronger, and with increasing country ownership and leadership of the prioritization of the emergency. We are proud to be part of the HIV Alignment Agreement that brings together the government of Nigeria, PEPFAR, and the Global Fund, and enables joint planning at all levels, and thus has helped us improve synergies, reduce any duplication, and enhance coordination towards common goals. Your Excellency, Nigeria has shown remarkable progress in the fight against HIV/AIDS over the last couple of years. Despite service disruptions at the start of the pandemic, swift implementation of programmatic adaptations have demonstrated Nigeria's resilience. And through the alignment program, we've actually seen a scale up of enrollment to treatment despite enduring the COVID-19 pandemic. Increasing the coverage of antiretroviral treatment is a remarkable success in the circumstances. And now we see another important step in this fight, the launch of the HIV Trust Fund of Nigeria. This is particularly important in terms of mobilizing more resources from the private sector to make significant and sustainable contributions towards funding HIV programs across the country. Because as Nigeria moves towards 95 for HIV, sustainability will be a critical determinant of success. And that has to be underpinned by significant additional domestic resources to support HIV health services and programs, including significant contributions from the private sector. Only in this way will we see achievement of 95, and to see that achievement sustained. So we see the launch of the Trust Fund as a really important initiative, and the Global Fund will continue to support the development of an integrated domestic resource mobilization and sustainability plan for HIV alongside TB, malaria, and programs to support resilient and sustainable systems for health. The creation of the HIV Trust Fund of Nigeria is therefore an important moment in reinforcing the sustainability of the national response against HIV. We look forward to collaborating through the National Agency for the Control of AIDS, NACA, with the Trust Fund, and the leaders from the private sector that have come together to mobilize additional resources. I am fully aware that Nigeria, through the country coordination mechanism, chaired by the Honorable Minister of Health, has already identified priority areas for further investment that could not be funded with existing resources. These areas include certain prevention interventions and health products, such as condoms, as well as prevention services for young women and the provision of HIV self-tests. We encourage national stakeholders and the country coordinating mechanism to engage with the HIV Trust Fund to explore possible cooperation on funding these important areas. I'd also like to commend, as my partner and friend Winnie mentioned, the particular focus of the Trust Fund on the prevention of mother-to-child transmission of HIV. This is an area that has not seen quite as much progress as other aspects of the fight against HIV. And we, along with other partners, are committed to supporting innovative measures to increase the coverage and effectiveness of prevention of mother-to-child transmission programs. And we really welcome the engagement of the HIV Trust Fund of Nigeria in this priority area. Your Excellency, under your leadership, the fight against HIV has made significant progress, actually remarkable progress in Nigeria, given the context of the COVID-19 pandemic. The launch of the HIV Trust Fund is an important milestone in driving the next phase of this fight and the sustainability of our collective efforts. So I congratulate you, and I congratulate the leaders of NACA, the Health Ministry, of all involved in this important moment. Thank you.
Thank you very much. Please can we put our hands together for Mr. Peter Sands, Executive Director of the Global Fund. I would like to invite to the podium, Excellency, the United States Ambassador to Nigeria, Ambassador Mary Beth Leonard. Please may we put our hands together for her.
Yes, it does work. Your Excellency, Mr. President, Secretary to the Government of the Federation, the Chief of Staff to the President, honorable ministers, diplomatic colleagues, luminaries of Nigeria's health sector, luminaries of Nigeria's private sector. Good morning, and let me say what a pleasure it is to be here to mark another milestone in Nigeria's road to HIV epidemic control. Today's inauguration of the HIV Trust Fund creates an opportunity to bring Nigeria's dynamic private sector into efforts to expand domestic investment in HIV control. Since 2003, the U.S. President's Emergency Program for AIDS Relief, PEPFAR, has invested more than $6 billion in the national HIV response. We currently provide about $400 million a year in a program focused on life-saving antiretroviral treatment and HIV care services to over 1.6 million Nigerians. This achievement is the result of the compassion and generosity of the American people and a consistent commitment across many U.S. administrations to fight HIV with host governments and Global Fund partners. Even the COVID-19 pandemic did not slow our march toward controlling HIV. On the contrary, our data-based targeted surge activities put more than 500,000 Nigerians on life-saving treatment since we launched them in late 2019. We did this in partnership with governors of high-burden states who joined us in meeting the challenge of identifying people living with HIV. The next phase of our game plan is to sustain these gains by ensuring that funding gaps are filled to keep people living with HIV on treatment. This requires mobilizing resources and pooling them for high-quality, equitable HIV services from the government and other contributors, such as health insurance, to closing this funding gap. Our placement of people on treatment means that they can contribute to the development and prosperity of their country. The United States remains committed to supporting Nigeria in reaching and sustaining HIV epidemic control, but we also believe that national ownership is critical to its success. This is where the private sector, which depends on a healthy workforce, comes in. The HIV Trust Fund represents a major component of the government's resource mobilization strategy. Private sector support for HIV is critical to sustaining current programs, particularly for commodities such as test kits and drugs. The United States applauds the National Agency for the Control of AIDS and the National AIDS STI Control Program for its forward thinking in mobilizing private sector support through the HIV Trust Fund. I urge all of you gathered here today to ensure these efforts are fully resourced and operationalized. We are excited to have new partners in the fight against HIV and increased government ownership of the care and treatment of the 1.6 million Nigerians we now support. These Nigerians will need treatment for life. By getting tested and treating, they have put Nigeria on the verge of epidemic control. We cannot let them down. I thank you for your attention.
Thank you very much, Ambassador. Could we just give her a round of applause again, please? So at this point, it's my distinct pleasure to invite the Secretary of the Government of the Federation, Mr. Boss Mustafa, to give his own remarks. You're welcome, Mr. Mustafa.
Your Excellency, President Muhammadu Buhari, President of the Federal Republic of Nigeria and Commander-in-Chief of the Armed Forces, members of the National Assembly here present, members of the Federal Executive Council here present, the Chief of Staff to the President, permanent secretaries and heads of departments, members of the board of NACA, members of the diplomatic corps, and our development partners, captains of industry, chairman and members of the HIV Trust Fund of Nigeria, distinguished guests, ladies and gentlemen, gentlemen of the press. Your Excellency, today marks a key step towards ensuring no child is born HIV positive in Nigeria. This comes on the heels of ongoing leadership efforts demonstrated by Mr. President's commitment towards ensuring that no one dies as a result of HIV condition. It is indeed on record that additional placement of 50,000 persons on HIV treatment annually continues to be financed by the federal government. I am aware of NACA's efforts to promote local resource mobilization to complement existing external support from our partners for sustained HIV prevention and treatment interventions. Today's launch of the Trust Fund will serve to guarantee funding from the private sector-led resources for HIV interventions, especially for the elimination of mother-to-child transmission of HIV. Since 2005, about $6.2 billion has been spent on HIV response in Nigeria. About 80% of these funds were contributed by external donors, mainly the the US President's Emergency Plan for AIDS Relief, PEPFAR, and the Global Fund to fight AIDS, tuberculosis, and malaria. The private sector contributed between 0.1% to 2% of total funds, with the rest of funds provided by the Nigerian government. The establishment of a private sector-led coalition against COVID-19, CAR-COVID, clearly demonstrates private sector's renewed commitment to support national response to emergencies and pandemics. Your Excellency, Mr. President, I will pause here to say, without fear of any contradiction, that the support provided by CAR-COVID in our national response, ably coordinated by your good self and superintended under the Presidential Task Force and now Presidential Steering Committee, accounts for how the world has acknowledged the response that Nigeria provided. I would say that if we did not have the kind of support we got from CAR-COVID, probably our response would not have been acknowledged worldwide as it was. And it also demonstrates one thing, that private-public partnership still works. And I believe that going forward, as a country, we must appropriate the benefits that are driven from those kind of partnership. And I believe that must have accounted for why the National Development Plan that has been put in place now would substantially be funded, almost 80%, by the private sector. And I think this is a very good development for our nation going forward, because government in itself is conscripted in terms of funds, and we must release these funds for basic social amenities and ask the private sector to step in and take its rightful place in driving the course of development in this nation. Your Excellency, the same industry giants and bank chiefs led by Alhaji Aliko Dangote that donated generously to this administration's effort to overcome the COVID-19 pandemic are today coming together to help ensure an AIDS-free generation by the year 2030. At this juncture, I would like to commend the organized private sector, development partners, civil society organizations, and all other stakeholders for their commitment and support towards making the dream of setting up the HIV Trust Fund of Nigeria a reality. Finally, I encourage all stakeholders involved to rally around the HIV Trust Fund of Nigeria to realize the meager sum of 62 billion target required to fill the funding gap for sustained elimination of mother-to-child transmission of HIV in Nigeria for the years ahead. I thank you for your kind attention, and I wish that we will raise all this money so that we do not become over-dependent on external resourcing. Thank you, and God bless you.
Thank you, Secretary to the Government of the Federation. Whilst we're here to launch this HIV Trust Fund, Mr. President, sir, with your permission, I'd just like to say that it isn't all doom and gloom. There are a few success stories. So it is my pleasure to invite one of those for whom we are doing this job to give us a success story from the NEPON, which is the Network of People Living with HIV and AIDS in Nigeria, to talk to us about the prevention of mother-to-child transmission as it pertains to her. May I invite Hadiza Ibrahim Banu to come and talk to us. As we give her a round of applause as she approaches the podium, please.
Excellency, Mr. President, distinguished ladies and gentlemen, good morning. My name is Adiza Ibrahim Banu. I'm a person living with HIV. I'm from Adamawa State. I found out my status when I went for antenatal care in State Specialist Hospital, Yola. And since then, I know my status. I have had 5 children, 5 babies, and they are all healthy, they are all well, they are all doing fine, and they are HIV negative. Currently, I'm a counselor in New Boshan Hospital, Jamaica Yola, and I'm also a role model to mothers positive living with HIV and AIDS. And under my care, I have 87 positive pregnant women, of which the whole of them gave birth to their babies, and the babies are all negative. And I advise all positive pregnant women, I counsel them, I mentor them, and to God be the glory. They adhere and they maintain their antiretroviral drugs, and they are all suppressed. Then our babies deserve to live alive and live free HIV world. But for us to achieve that, we have to come together. We have to get support from you, especially Mr. President, to prevent mother-to-child transmission of HIV, and the prevention from mother-to-child transmission is working, and elimination of mother-to-child transmission of HIV is possible. And together, we can do that. Thank you.
Thank you very much, Adiza Bana. It's nice to hear the success stories. It's part of the reasons why we're here today. The team has put up a documentary. We've been having a series of speeches. The team has put up a documentary that will better shed more light on the activities of the HIV and AIDS Trust Fund of Nigeria. So happy viewing.
Thank you very much. We'll give them a round of applause. So I'd just like to remind us of the theme. A Nigeria without mother-to-child transmission of HIV is possible when we all play our part. So we're warming up to the parts that we want people to play. And in furtherance of that, I'd like to invite the Group Managing Director of Access Bank PLC and the Board Chairman of the HIV Trust Fund, Dr. Herbert Wigwe, to give us his speech. Thank you.
Mr. President, the President of the Federal Republic of Nigeria, President Muhammadu Buhari, Secretary to the Government, Chief of Staff to the President, members of the Federal Executive Council here present, of course, members of the Diplomatic Corps, very, very distinguished ladies and gentlemen. Let me start by acknowledging members of the community of HIV/AIDS positive people who are living with us and assure them that we will continue to support them for as long as we can until we put HIV to zero. Mr. President, it's been said very often that strong people stand up for themselves, but stronger people stand up for others. I think today we're here to stand up for those who deserve the first right of all human rights, which is the right to live and the right to lead a reasonable life. We're here to stand up for about 1.7 million to 2 million men and women living with HIV out here in Nigeria. But just as important, or perhaps even more important, is that we stand for 130,000 of our children living with HIV in Nigeria. Prior to the global spread of COVID-19, HIV was one of the most serious health challenges since the first cases were reported in 1981. But unfortunately, as the world was forced to turn attention and resources to fighting COVID-19, HIV testing, treatment, and prevention programs were disrupted. The health system in Nigeria, obviously, like in several parts of the world, is already currently overstretched by the COVID-19, and those with HIV are not receiving the treatment that they need. Nigeria ranks amongst the top 3 of countries that are dealing with this pandemic right now, because less than half of our people living with HIV have access to treatment, and women and girls account for the majority of new infections. We must eliminate the disproportionate vulnerability of our girls to HIV. This disparity cannot continue if Nigeria is to grow into a great nation. But by far the greatest challenge we have today is funding. Over 80% of the funding for HIV has traditionally been mainly from international donors, and the private sector has contributed only about 8%, only about 2%, and government has provided the rest. But we all know what is happening to donor funding across the world and the fact that there is donor fatigue. And we started seeing it from 2012 when donor funding basically plateaued. And of course, other forms of support have been very, very inconsistent. With the post-COVID economic realities, all funding for HIV have been very, very, very severely threatened. And it is now safe to say that this situation must be urgently addressed. Access Bank became a founding member of HIV Trust Fund more than 12 years ago. And today, this $100 million HIV Trust Fund that is being created will be a sustainable private sector-led platform that aims to reduce the burden of HIV/AIDS in our society by focusing on the prevention of mother-to-child transmission. We believe that this approach will have a much more successful impact on reducing HIV than individual efforts. Over the years, Access Bank has worked with the Nigerian Business Coalition Against AIDS, which is called NIBUCA, and this is the organization that has been created to create the HIV Trust Fund. We've also worked alongside NACA to lead the private sector's efforts in addressing the HIV/AIDS pandemic in Nigeria. naturally, we will not hesitate to partner and sponsor the HIV Trust Fund of Nigeria. We will give it all the support it requires. We will work diligently with all these organizations to increase HIV awareness and support those people already living with the virus. They deserve the basic right to live and to lead a decent life. It was Bill Clinton who said that today we live in a completely interdependent world, which means that we cannot escape each other or one another. And how we respond to HIV/AIDS depends in part on whether we understand the extent to that interdependence. It is not someone else's problem. It's a problem that belongs to each and every one of us. Your Excellencies, Mr. President, dignitaries, members of the diplomatic corps, ladies and gentlemen, this problem is our own problem to solve. And other African countries are showing that this can be done. Early in December, Botswana became the first country with a severe HIV epidemic, now approaching the elimination of mother-to-child HIV transmission. I happened to spend quite a bit of time in that great country at the peak of the epidemic, and I can tell you that we are not anywhere near them. So for them to be where they are today, it just shows that it can truly happen. Eswatini has already passed the target set for 2025. Côte d'Ivoire has reduced HIV infections from 100,000 at the height of the pandemic to 6,000 and falling. All that these results show is that this is very, very possible, particularly in Nigeria. With all the resources that we have, I think we can do a much better job. On behalf of the conveners and my fellow board members who have been able to make it out here today, I call on all of you to support the Trust Fund and to eliminate HIV from our society. 1.7 million Nigerians depend on us now. And given the rules around interdependency, all Nigerians depend on us for a future without HIV. We must ensure that no child is born with HIV in Nigeria and in Africa. And more importantly, your thoughtfulness, kindness, and commitment now will change the lives of many Nigerian children who represent our precious future of tomorrow. Thank you very much.
Thank you. I think that we can give Dr. Wigwe another round of applause for that. Thank you. Right, it's a bit difficult, and I approach this with trepidation. I'd like to invite the chief launcher, Alhaji Aliko Dangote, to take this action on the call to action and solicit for the commitment towards this launch of the HIV Trust Fund. Can we give Alhaji Dangote a round of applause as he approaches here?
Your Excellency, President Muhammad Buhari, President Federal Republic of Nigeria, and also Commander-in-Chief of the Armed Forces, members of the National Assembly that are here present, the Secretary to the Government of the Federation, the Chief of Staff to the President, members of the Executive Council here present with us, members of the Diplomatic Corps, Chairman NACA, DG NACA, Captains of Industry, Chairman Board of HIV Trust Fund, Mr. Herbert Wigwe, board members of HIV Trust Fund, distinguished ladies and gentlemen. Today marks an important milestone in building a coherent strategy for private sector engagement against HIV/AIDS. As we launch this fund, I am reminded that we have about 2 million of our compatriots living with HIV/AIDS. And it is our collective responsibility to bring this number down to 0. We have heard what the problem is, what the facts are, and the rationale for the HIV Trust Fund of Nigeria. I don't need to go over them. My job is to encourage all of us to contribute to this $100 million fund that will be led by our very able Dr. Chikwe Ozomene. The private sector can only play an important role in mobilizing domestic resources, capabilities, innovation, and advocacy platform to enable us manage HIV/AIDS in our country. NIBUCA, which is Nigerian Business Coalition Against HIV/AIDS, which counts most of the organized private sector in Nigeria as members, has done a great job over the past 15 years, and this fund is expected to take us further. We have all witnessed the increasingly significant investment the private sector has made in the health sector over the past few years. From the Private Sector Health Alliance of Nigeria, PISHAN, to the Nigerian Business Coalition Against HIV/AIDS, NIBUCA, the African Business Coalition for Health, and COVID and others. This demonstrates our understanding of the importance of the private sector's role in solving our health issues. This $100 million fund is now meant to move our progress even further. The presence of His Excellency, Mr. President, to this launch today, alongside our captains of industry, is a strong show of support that should encourage us to work even better with our government counterparts to solve the problem of HIV/AIDS in our country once and for all. The money we raise for this fund will be used to get all pregnant women in Nigeria tested for HIV, get those that tested positive onto treatment, and to follow up with counseling and support to make sure they are not discouraged by their diagnosis and follow the drug regimen. Mr. President, sir, we are expecting that the federal government's contribution to the fund. We would like for the private sector to work in partnership with the federal government on a 50-50 basis, which we believe will help us eliminate mother-to-child transmission of HIV/AIDS in Nigeria. I'm happy to announce that in addition to contribution to the administrative cost of running this fund, I will also contribute to the HIV Trust Fund over the next 5 years, and I'm calling on all partners in the private sector to join me to make this a great success. Thank you very much.
Thank you very much for that donation. Can we give him another round of applause, Alotus Dangote? So he's not the only one that will do this, so it's important that we get some help. Round the room, if we can just show by show of raising your hand, some other contributions to this. I don't want to put a dear friend on the spot, but I'd like to ask the head and CEO of the trust fund to invite, I think, since I'm not part of your ilk, it's difficult to know who to invite out to here.
Mr. President, sometimes we find members of the private sector very shy to stand up to make commitments. But please permit me to invite some of them, some of the largest companies in the country, to support what we are doing. And I think I'll start by calling on the chairman of Shell, Mr. Osage Okumbo, to come and basically say a few words on his level and the level of his commitment to the HIV Trust Fund.
Mr. President, please permit me to stand on the existing protocol. Shell is a committed member of NIBUCA, We have been there from the very beginning. We stay and remain extremely committed, just like Alhaji Dangote has said. We would also contribute handsomely to this fund over the next 5 years. Thank you, Mr. President.
It will be inappropriate for me to call Osagi alone without referring to his colleague from Total Energies. Mike Sangster, please.
Mr. President, allow me also to stand on existing protocol. Yeah, Total Energies is also a very proud member of NIBUCA and has been for many years, and obviously proud to be here today as part of this this trust fund launch. And I think we will continue to be an active member of NIBUCA and continue to contribute to the fight against AIDS in Nigeria. Thank you.
These figures represent millions of dollars over the next 5 years, even though they've refused to state the specific amount. By far the largest construction company in the country, and has been here for several decades. Sometimes they now claim they're a Nigerian company, but we know their origins. Julius Berger, represented by a CEO. Berger, please come and make a few comments. Even if you don't call figures, I think it will be in the same neighborhood as Shell and Total.
Thank you, Mr. President, SGF, the Chief of Staff. Please allow me to stand on existing protocol. For me personally, it's a great event. I mean, it was a long way. And NIBUCA is existing for so many years, and today the launch is one big milestone which we have achieved. And Julius Berger is still committed to go the long way to 2030, where we hopefully can put HIV to zero. Julius Berger is committed to this one. Thank you.
Thank you very much, Mr. President. We will subsequently be carrying out a different type of campaign across the country, reaching out to retail contributors, sharing with them the fact that it's not just a corporate issue. All Nigerians, as much as we can, that can contribute to the HIV Trust Fund, will do so, and there'll be proper governance and accountability around how the funds are used. Thank you very much, sir.
Thank you very much, Dr. Wigwe, for assisting with that. Just to mention that there are quite a few people here who are possibly equally shy. So there are some commitment cards that we've distributed around the room. And if you have got any contribution to make, you can just put that down in writing. If you want to remain anonymous, I think what's quite important is the figure and being able to do your pledge and promise. Thank you. Can we just give the private sector a round of applause again, please? So at this point, I'd like to invite, with all humility, the President of the Federal Republic of Nigeria, President Muhammad Buhari, to give us his address. Can we rise as he comes to the podium? Mr. President, sir.
Thank you. Please sit down. The Secretary to the Government of the Federation, the Chief of Staff, Honorable Ministers, Captains of Industry, members of the Diplomatic Corps, Director General, National Agency for Control of AIDS, National Coordinator Network of People living with HIV in Nigeria, Director Generals, Executive Secretaries, Senior Government Officials, invited guests, ladies and gentlemen. I am pleased to receive you in State House today for the launch of HIV Trust Fund of Nigeria. This administration has continued to prioritize health intervention to address killer diseases and public health emergencies. At the last United Nations General Assembly high-level meeting on HIV/AIDS, I made a call for a renewed global action to address the HIV/AIDS epidemic in Africa. Ending AIDS as a public health threat in Nigeria will require increased domestic funding. We have continued to make good our commitment of placing more people living with HIV on treatment annually using national resources. However, strong domestic resources mobilization with an enduring partnership and shared responsibility is required to sustain the response to HIV and other emerging public health emergencies. Our purposeful partnership with the private sector in our response to coronavirus pandemic provide a readily available financing solution that we can leverage on to sustain the HIV response. Let me therefore commend the National Emergency for Control of AIDS and the Nigeria Business Coalition Against AIDS for their efforts in establishing the HIV Trust Fund of Nigeria to secure a generation of babies free of HIV. I am pleased with the attendance in person of notable global key players in HIV response and from the private sector in this event and the pledges they have made today. Going forward, I hope the HIV Trust Fund of Nigeria will galvanize more of the private sector and others partners to surpass the target of 62 billion naira in the next 5 years. I now officially launch the HIV Trust Fund of Nigeria. I thank you all, and may God bless the Federal Republic of Nigeria.
Thank you, Mr. President. Just to inform us, ladies and gentlemen, that tea is served behind the curtains over there. There's a light lunch for us here. Thank you very much for your attendance. Thank you.
Continues to create a tremendous strain on healthcare systems in Nigeria. UNICEF presents that globally, at least 300,000 children were newly affected with HIV.
2021 World AIDS Day. 1 out of every 7 children.
Curbing the spread of HIV continues to create a tremendous strain on healthcare systems globally, Nigeria included. UNICEF presents that globally, at least 300,000 children were newly infected with HIV in 2020. Now, of this alarming figure, Nigeria was responsible for 20,695 cases. Sadly, this slows down our efforts in the fight against HIV/AIDS, and more so, this indicates a need for a much more strategic approach to prevent further decline in the nation's HIV infection rate.
One of the biggest areas, one of the most critical areas where Nigeria has not done well in terms of HIV/AIDS intervention is in the prevention of mother-to-child transmission. According to a report by UNICEF in the run-up to the last 2021 World AIDS Day, 1 out of every 7 children born globally HIV positive is born in Nigeria. To put it from a nominal perspective, out of the about 300,000 children born HIV positive, over 20,000 of them were born in Nigeria. This is a crisis of immense proportions, and it can potentially erode all the good work we've done over the last 2 decades. So the HIV Trust Fund of Nigeria is not just stepping in to bridge the gap to raise funding or support government to raise funding for HIV/AIDS intervention. We have decided to focus specifically on the prevention of mother-to-child transmission of the virus.
Transmission among the general population, transmission among the key affected population, and transmission from mother to child. The taps in the general population and key affected population are now running slowly. However, that of mother-to-child transmission is the one that is still running fast. And this means this year, 2022, we're going to look at expanding our services to include every pregnant woman and get them tested and make sure that every HIV-positive pregnancy is prevented from transmitting that disease to the newborn.
Access Bank is incredibly proud to be one of the leading private sector institutions that have come together to launch the 50 billion naira HIV Trust Fund. The fund, launched under the umbrella of the Nigerian Business Coalition Against AIDS, which is NIBUCA, will ensure that future generations of children who would otherwise have been affected by mother-to-child transmission of HIV during pregnancy will be delivered HIV-free. The prevention of mother-to-child HIV transmission has over the years proven to be one of the most sustainable ways to eradicate AIDS and ultimately stamp out HIV in Nigeria. Consequently, this is the primary objective of the Trust Fund. We hope that with this significant capital infusion, we can catalyze innovation and public-private partnerships to bring the next wave of novel approaches to tackle this challenge. As an organization driven by the zeal to sustainably impact societies, Access Bank is proud of our decade-long commitment to driving HIV/AIDS eradication efforts in Nigeria. We understand our role in driving change, and as such, we are committed to aiding people with HIV/AIDS in their quest to live a decent life while ensuring we raise awareness about prevention and treatment. Joining and supporting the HIV Trust Fund of Nigeria is the next step in this legacy that enables us to contribute significantly to strategic remedial action for the future.
It is an opportunity for pregnant women living with HIV, that's our positive mothers, opportunity to be able to have comprehensive HIV services that they required.
Our objective is to ensure that no child born in Nigeria is born HIV positive, no child born in Nigeria becomes an orphan because of HIV, and any child born HIV positive will have access to the full treatment regimen that will enable the child live a normal and productive life.
Our aspiration is that no child in Nigeria will be born with HIV. No child in Nigeria will be an orphan because of HIV. And no child in Nigeria will die due to lack of access to treatment. With your support, we can ensure that the future generations of Nigerians are born free from HIV.
Every unborn child has the right to be protected from HIV. And we can only do that if we get every pregnant woman tested and HIV positive pregnancies prevented from transmitting the virus to the newborn.
Given the magnitude of the prevention of mother-to-child transmission need, the HIV Trust Fund is timely and will be critical in helping us address the gaps in acquiring test kits, laboratory reagents, and drugs for pregnant women over the next 5 years. We are excited about the private sector commitment to this cause and wish to thank them in advance for their engagement.